Hi sir, welcome to the show, and it's been a pleasant evening. And to introduce sir to our viewers, this is Dr. Brigadier Shashi Vardhana, who is a renowned neurosurgeon and also of very high ranks in the armed forces. Welcome again sir.
Thank you, Dr. Jaydev, for this interview and coming for this lovely Sunday evening.
From the medical profession, you reached good ranks, being a neurosurgeon, and I'll come to the details of your degrees a little later. High ranks, and it's quite rare to find this combination, that high ranks in the army, high ranks in the medical profession. Congratulations on this, and it's a pleasure that you made time, decided to spend this evening with us.
Thanks a lot. In fact, it's an honor for me to be speaking to you as not only as a friend but as a junior colleague and a neurosurgeon from Bangalore.
Can you tell this sir, आर्मी में कैसे आना हुआ, कैसे आर्मी कैसे?
देखिए, the thing is that my father also was in the Army Medical Corps.
Okay.
My father also was a doctor, and as a child I would see him, attending to emergencies and saving lives. And also I had a good idea about the army life because I was staying with them, so most of the times, the kind of things they have in the army, attending to emergencies, going for various field kind of duties, difficult terrains. We were used to be staying alone. So all in all, the complete life of army was quite enriching and enchanting for me. So army also was one of the choices, but at the same time I also wanted to become a doctor. So by joining Armed Forces Medical Services, I could achieve both. I could become a doctor as well as be an army officer and see and enjoy the army life.
So your father was also a medical professional in the army?
Yes, my father actually, he is a product from Madras Medical College.
Okay.
And he joined the army, and since then I have also been staying with them only. And subsequently I joined the Armed Forces Medical Services, AFMC. In AFMC Pune I went and did my MBBS. In the year 1988 I joined, 92 I passed out, and then I was a permanent commission in the army. So here I am after 31 years of service in the armed forces, taken voluntary retirement, that is premature release, and now instead of working for the people and serving the soldiers, now I've got a chance to serve the people of Bangalore with my professional skills.
Nice sir. So if father was in the army, that means as a child you've been seen many places of India, as
Yes,
in
yes.
transfers, postings,
Because
that would have had an influence on you.
yes, in the army actually every 2 to 3 years my father would get transferred from one place to the other, and we have seen at least 10 to 12 different places during my tenure till I joined for MBBS at AFMC Pune, and most of them have been in the north.
Okay.
So it has been a good experience being from the south, but most of the times being serving in the north, it was a very good experience.
Nice sir. The common people who are not from the army will have certain curiosity about the army. Do you undergo arms training?
Yes, actually any person who joins the armed forces, whether it's as a doctor, as an engineer, there is some compulsory military training which he has to do. We have trainings in the armed forces medical services as doctors, something called the MOBC, Medical Officers Basic Course, MOJC, Medical Officers Junior Command, then MOSC, Medical Officer Senior Command. As you go up in rank, at each time you have got small courses which are conducted in Lucknow and in Pune, in which they tell you not only about your profession, that is as a doctor, but they also teach you about the various military duties that you are supposed to perform. So that military training, it not only includes the care, combat medical care, but they also teach you how to handle firearms, ammunitions, and they tell you briefly about the other armed services which are there in the forces, the 1.5 lakh, the strong forces that we've got. So they tell you about all the other structures of the army, so that you get oriented to the army way of life.
Nice sir. Can you, when I was doing my little research on you, you served in J&K sir, am I right?
Yes, actually Jammu and Kashmir I had the opportunity to serve immediately after my MBBS for 3 years, and then also as a general surgeon after my MS general surgery for a brief period, and then again as a neurosurgeon also I would get opportunities to come to Jammu and Kashmir for small durations of 1 month and short durations to come and work there in the command hospital.
the difference between working in a full-fledged city with all amenities is quite different from the army, where you will have to deal with the minimum. You will know how to matlab jugaad se.
Yes, you're absolutely right. Whenever we are serving in the forward areas, especially as a surgeon, there are many things which are there at a constraint, at a premium. Number one is time, because the casualties, they may reach you on time, or they may reach very late, where we don't have any other time to send them further to a higher center. So time is at a constraint. The second thing is resources. Being in the forward areas, it is not like a tertiary care hospital. Forward area means the area which is around, say, 200 to 300 kilometers from the border.
Okay.
So at these places, we have only the basic staging unit, where only the basic first aid can be given. We cannot give them, we can't give them high-end surgical care in terms of any neurosurgery or any other major surgeries. For that, we have to stabilize the patient and then send them further down to a larger hospital, which takes time. So the three things which we face the challenges: one is the time, second is the resource, and third is trained manpower. Because like in any specialty, especially for surgery, it is just that having a surgeon doesn't suffice. One has to have a surgeon, one has to have an anesthetist, the ORAs, the operating room assistants who are trained, the nurses. So the entire team of people is required. So these three things are the main challenges serving in the forward areas.
Okay, sir. Did you had an opportunity to serve during the hostile period, as in war situation? Did you?
Yes. I had the opportunity in JNK when I was there. Initial posting, I was there from 94, 93 to 96. After that, I went for my PG. So at that time, the militancy was there at its peak. At that time, I would, as a medical officer, I had to go for evacuation of many casualties from the site of injury, taking them to various hospitals, to the Srinagar base hospital. Then, as a general surgeon, when I was there, at that time also militancy was at its peak, and it was a wonderful experience as a general surgeon, because I could attend to any kind of trauma. In fact, I developed my interest for neurosurgery, being there in Jammu and Kashmir as a general surgeon, wherein we used to get gunshot wounds which would involve the head, the chest, the spine. So any part of the body I would operate under the guidance of my seniors, and that's why I developed an interest for neurosurgery. And subsequently, before that, even during the Kargil war, although we were not in direct contact with the enemies, but at that time I was stationed at Rajasthan.
Okay.
Wherein we were there stationed in the camps, waiting for any eventuality for at least 3 months, and then of course we came back. So combat, as a general surgeon, I was happy that I had a good exposure to various combat scenarios, especially trauma in the armed forces, which is very rare to get in the civil.
And once again, correct me if I am wrong, sometimes you served 31 years in the armed forces, and maybe your medical colleagues or your friends whom you studied during your when you are teens, they might have in doctor profession, they would have taken the non-medical forces practicing in cities. Did you ever feel that did you feel the grass is greener on the other side? Did you feel, or you are self-sufficient? Any such?
See, the basic nature of human beings is always we compare ourselves with others. So I would put it this way, that yes, I did have colleagues who were going parallel with me. Some of them went on to civil from class 12th. They went on to do their MBBS and their post-graduation all from the civil. And subsequently also we have been meeting and we have been exchanging notes. So the initial part which I found in the armed forces is something which the civil life cannot offer. Because as a young captain, immediately after MBBS, the kind of respect and the kind of honor that you get to serve the nation, that is something which you don't get in civil. But as you go up in seniority, then when you start comparing yourself with your peer groups who were there with you, you find that they are doing better in the civil life, because they are practicing only is their profession. They are not into military duties. Whereas in the armed forces, it's a dual role. One has to work as an army officer, where you have got certain duties which you have to perform. In addition, you have to do your duties as a doctor, which may be as a surgeon or as a neurosurgeon. So obviously, in case you have to do 2 different duties, you can't devote the full time to your profession, because military duties also take their toll.
Very true, sir.
So when you, at the later stages, you find that your peers who are there in the civil, they are doing better because they have much more experience and exposure as compared to the other military counterpart.
All right, sir.
So initial part of the race, you feel you are better, But later on you realize that they are also doing quite well.
When I was reading about you, I heard you had worked with the US Navy. Can
Yes.
you tell me something
Yeah,
about
that was another very good experience. Actually, immediately after my general surgery, I was posted to Jammu and Kashmir as a general surgeon in one of the tertiary care hospitals. This was stationed in Udhampur. So, during my initial months only, there was a call which had come from the army headquarters saying that I was selected to go for the go with the US Navy. And this was the year 2006, and 2004-5 is when the tsunami hit most of the Southeast Asian countries. So the American Navy had taken out a exercise in which they had a ship called the USNS Mercy. This ship was deployed to give humanitarian assistance to all the people of various countries who were affected because of the tsunami. So in that, the Indian Army also was told to chip in, and I was one of the surgeons from the Indian Army team which had boarded on board USNS Mercy. Let me tell you something about the ship. Interestingly, it is one of the largest hospital ships in the world.
Nice.
It is around 900 meters long. It has got a bed capacity of 1000 beds.
900 meters, like 1 kilometer.
It's 900 feet, sorry.
Uh-huh.
And it has got a capacity of 1000 beds. It has got 12 operation theaters. It has got CT scan. It has got a blood bank. It has got all the ancillary services. And the ship is self-sufficient in the sense that it can take care of itself even when at sea. It has got its own water treatment plant. So the water from the sea is taken, recycled into drinking water. And this humanitarian assistant, it started from the San Diego port, and from there they came to Philippines, from Philippines to Indonesia, Singapore, went up to Chittagong, Bangladesh, back to Singapore, and then finally I was dropped at North Australia.
The experience of a lifetime.
So it was sailing with the Americans, interacting and learning the new skills, teaching them your own skills, and performing various surgeries on the people.
Nice, as in
International patients.
as per what you explained, it's like 3 tertiary hospitals on sea.
Yes, it is as good as 3 tertiary hospitals on sea with the complete all the backup.
Nice. Can you enlighten us a little bit about your stint with AFMC as HOD neurosurgery? How what the department went?
Yeah, see, actually my association with AFMC has been for more than 30 years. I started my journey as a medical student at AFMC in 1988.
For our viewers, sir, there will be most of the non-medicos also. So if you can tell what is AFMC, they won't even know what is AFMC.
So AFMC actually stands for Armed Forces Medical College. This college is one of the premier institutes of India, also ranked among the top 5 in India, and its inception was in the year 1962. Since then it has been churning out medical graduates who are of very high caliber, and that was my opportunity to join AFMC in 1988, and I passed out in 1992. So that was my first tryst with AFMC to graduate. Subsequently, from 99 again I came back to AFMC to do my MS General Surgery for 3 years. Then I again got posted out as General Surgeon to various places. Then after that again I came back to AFMC to do my MCH Neurosurgery. This was from the year 2007 to 2010. Actually, in the army you can't do your specialization, super specialization one after the other. There are some mandatory periods, like 4 years after general surgery one has to do some mandatory duty as a general surgeon. So that was my third coming back as a neurosurgeon to AFMC. And lastly, after this, all this 10 years, again finally I got posted to AFMC as a professor and HOD. So it was one full cycle completed, wherein you come as a student, you come as a postgraduate, you come as a super specialist, and finally you come as a teacher, wherein you are teaching the students who you were once upon a time. That is when you were teaching undergraduates, postgraduates, and also MCH students. So that is something which will have very sweet and very fond memories throughout my life.
Right, sir. And one more thing, sir, what I've heard when serving with the Indian Army, apart from fighting the enemy, who is the true enemy, I've heard weather is also another enemy.
Absolutely.
So can you, any hostile weather conditions you faced, suffered?
Actually, whenever the two places where I had seen a lot of damage to the forces caused because of weather is, one is in Jammu and Kashmir, and second is in Chandigarh. I was posted to Chandigarh as a general surgeon. So in Chandigarh we used to have a lot of patients who were coming from high altitude. because ours was the tertiary care hospital from where patients would be evacuated from the far reaches of Siachen Glacier and also the forward areas. And surprisingly, 90% of the patients who would come in emergency were not because of enemy action, they were because of the weather. People would come with frostbites, high altitude pulmonary edema, and lot many patients of stroke who used to suffer stroke in the high altitude. So I think there as a neurosurgeon I must have done the maximum amount of decompressive craniectomies to treat young soldiers with ischemic stroke. So that was my exposure for the weather. Whereas in Jammu and Kashmir when I was posted, it was more because of enemy action, gunshot wounds, improvised explosive device which we call as the IEDs, where the militant would place those devices under the road and any convoy or anybody going over, they used to be having a blast. So these were two areas where I learnt about the enemy action wounds and also the wounds caused because of weather. So you're absolutely right that more people as on date are getting disabled because of the weather rather than because of enemy action.
Right, sir. One more thing, what I believe is in a hospital, a doctor is in a leader position, whether you call yourself a leader or not. Yes. When you step in a ward, a doctor is a leader, all the nurses and all the paramedical staff see you as a leader, your actions, they will take actions. Having said this, army is one place where you are ingrained with the highest values of leadership. Correct. So can you tell how the qualities of leadership which the army taught is helping you in your practice of leadership, and what are your ideas, philosophies of how leadership in medical?
See,
can you tell me?
Absolutely. See, whenever we go to in the army, the leadership quality is one of the main qualities which is ingrained into all army officers, whether they are from the medical services, they are doctors or they are non-doctors. So as a leader, like I tell you the example between now that since I have come into the civil life, I have been seeing the hospitals, working in civil hospitals. In army, as a medical officer, in case you are assigned to a ward, for example the neurosurgical ward, so the complete upkeep of the ward is the responsibility of the medical officer in charge or the neurosurgeon. Right from the patient's care, that is what are the medicines they are giving, the treatment in time, what is the food that is being given to them, what is the kind of dress that is being given to them, the kind of toilets which are the ancillary services, whether it is tip top, the clothes that they wear, the electricity, the complete stay of the patient in the hospital is the responsibility of the doctor. Whereas in civil practice, we find that your areas of responsibilities are limited. You are only focused towards patient care. Other things are taken care by the other ancillary services. But here in the army, we are responsible for it. We may not be directly involved in cleaning up the place or taking care of the toilets, but the responsibility, the onus lies on the doctor. So that's a major difference, because here you own the patient and everything is your responsibility. Whereas in the civil, you do your work, that is also good, but you've got only very certain limited areas of focus. So that's a major difference between the army and in the civil.
And one more thing, you are also known for your fitness. So in years to come, if I have to be as fit as you at your age, any tips, what?
See,
ideas?
The thing is, for any kind of profession, especially for medicine, one has to be physically fit. Especially as a surgeon or as a neurosurgeon, where it involves long hours of physical consistency. You have to be standing and operating for hours together with one pointed dedication, determination and absolute precision. There is no scope for doing any mistake. So if the human body is not fit, you cannot do any surgeries. So you can't take off your patients. Luckily for me, right from my childhood, I was very much interested in games and sports. In fact, as a child also, my mother used to be always running after me, because during exams also I needed that half an hour of break to go out, play with my friends and come back. And the same thing translated when I joined AFMC also. I used to be going for runs and I used to take part in various sporting activities like badminton, athletics. During my internship, I was part of the Southern Command team, for the badminton championships. And but physically, I have been always spending at least 1 to 1.5 hours daily of my daily 24 hours to my physical fitness. Even at this stage, even after taking premature release, after coming to Bangalore, here I make it a point, at least 1 hour I devote it for my physical fitness.
Can you be more specific, sir? Physical fitness, and what do you do? Your exercise regime?
Physical fitness is in the morning 1 hour I do around 15 kilometers of cycling.
15?
Yes, 15 kilometers of cycling, that's around half an hour. And that is followed by weight training. and after that I also do some amount of meditation and some yogas just to keep myself fit, because physical fitness is not only physical but it also involves mental fitness.
Yeah, very true. Mental fitness.
So in these turbulent times wherein there are a lot of stressors in life, one has to keep mentally also fit. Only then you can carry on your day-to-day activities effectively.
Yes, sir.
Because every moment is, you have to take decisions in life which have got a far-reaching effect. Decisions concerning you, decisions concerning your family, decisions taken on patients, because in neurosurgery it is fraction of a second. Decision taken right, you save a life. If you take a wrong decision, you'll end up in a disaster.
Yeah,
So
both
for all
patient and
this-
doctor both land up.
Yes. So in my experience, I felt that if you are mentally balanced, you are in equanimity, and you are physically fit to take up any kind of surgical procedure, your patient outcome also will be better.
Diet also plays an important role. Any views
Yes.
on diet, sir?
Diet also, in the present times, fortunately or unfortunately, everything that you want is easily accessible. If I have got a sweet tooth, I enjoy eating sweets, but then I realized that over a period of time that if you are indulging in anything which is excessive to what is required or what the body can take, you will end up with certain kind of diseases. So initially, during my initial part, I was little obese as a general surgeon, but then so slowly I realized that if I have to be fit, I need to control my diet. So diet plays a very important role in life. Of course, it need not be very strict. You can have, you can always cheat once in a while.
Are you that
can-
kind of person who will calculate how many carbs, how many fats, so much?
No, I don't go by the calculations. I just see myself whenever I go to the gym, maybe once in a week or once in a fortnight. I just take my weight, and that itself tells me that whether I am going on the right direction or not.
Okay.
If I am losing weight, I try to build it up. If I am putting on weight, then I try to control my carbs and fatty diet. So that's how I keep myself fit. So there's no particular. I don't follow any regime. I just that I listen to my body. If my body says that you're getting fat, you're getting obese, you're not getting fit, so I try to get fit.
Nice.
I listen to my inner conscience.
Okay. And also, sir, one of your area, I've heard your talk on this artificial intelligence and its role in medicine.
Yes.
And there's so much talk about whether AI will replace doctors.
Yeah.
So views on that?
It's a very passionate topic which I am researching for the last couple of years, and I feel it's my personal belief that the way artificial intelligence is coming into the professions, especially the medical professions, sooner or later, artificial intelligence is going to take away major chunks of work from the doctors, and it is very possible that in future the doctors also may be pushed to the sideline, and the AI and the robots would be taking over the healthcare of humans.
So this is good.
It is in a way good and in a way bad. In a way good when I say that all these technologies, they are all dual-edged technologies. These technologies, they have to be harnessed in the correct way. If we harness them correctly, they'll be subservient to the humans, and they'll help you in increasing the longevity and keeping people healthy for life. But in case these technologies are not harnessed properly, they are done with some kind of evil intention, then it may be the other way around. The artificial intelligence and the robots may take over humans, and we may become subservient to them,
Okay.
and we may also face extinction. That's what is the prediction.
Okay.
So one has to be very judicious in handling this new technology, so that we reap the maximum benefits and we don't become servants to the AIs and robots in future.
Yes, sir.
But going the way things are going, I strongly feel that in the near future, maybe not in a couple of years, but maybe a decade or so, AI is going to have a major role in healthcare, not only in India but across the world.
Okay, sir. Anything you would like to tell the young professionals who have this apprehension? Will I lose my job? Will I make my living?
See, any kind of profession wherein the newer technologies are coming, they are at risk. But as far as the profession of medicine is concerned, the professions which are more at risk, I consider, are the non-clinical specialities. For example, if you're going for radiology, if you're going for pathology, wherein there is no much interaction with the patients, these specialities are slowly being taken over by AI because of the natural language processing, because of the computer vision, because of the machine learning and the artificial neural networks. It is for that in the last couple of years, so many studies are being shown that AIs can do better detection of malignancies like breast cancers, or better detection of tumor cells when you see them in the pathological slides. So slowly the AI is found to be more accurate and more sensitive and specific as compared to what the humans are. So the writing is very clear on the wall that sooner or later they are going to replace the non-clinical specialities. But as far as the clinical specialities are concerned, where one has to be interacting with humans, you have to be touching humans, operating on humans, it will take some time. It's at the moment no, but yes, it may take some more time. So probably the surgical specialities would last a little longer as compared to the medical specialities. Of course, no intentions of having any personal this thing. It is of course my only personal view based on the current body of evidence.
All right.
I may be wrong, I may be right.
All right. And having come quite a distance in the medical journey, and any visions that you have in my upcoming years of my career, I want to see this happening, anything like that? It might be your personal.
What I feel is that the disease, human beings, the ultimate goal of any kind of specialty in medicine is that the human should become immortal. So to achieve immortality, one has to be disease free. So to be disease free, medicine has to be preventive, participatory, and predictive.
Nice.
Which means that when the child is born, at that time only the genetic profiling and all the tests would be done, wherein one would come to know that this child is going to suffer from maybe a tumor, from blood pressure, from diabetes, and the treatment at that moment only is done by gene sequencing, by editing and other things. So ultimately what's going to happen is that the individuals are not going to fall sick in the first place.
Okay.
So once that is going to be taking place, then there will be no diseases. So that's what I feel like. The ultimate aim or ultimate goal of any medical specialty is now, of course, it is to treat diseases. But the future goal, what I foresee is immortality.
And you think that can become a reality?
In fact, some of the journals and some of the thinkers like Ray Kurzweil, Damasio, even for that matter, Stephen Hawkins, they have predicted that AI would come and probably humans would be immortal by 2045.
Okay.
In fact, it has come in the Times magazine by Ray Kurzweil, who says that by 2045 it is possible that humans could be immortal. So be alive till then, and also the viewers would request them to be alive till then. You might become immortal after that.
On a lighter note, I think immortality is more a problem than a good thing.
Eventually it's going to be a problem.
Mortality is a very sweet thing.
Yes. So with each positive things that come to your life, the negative things also will be associated. So life is a mixed bag. So you can't have only all the good things. So like you said, immortality things, other issues also will be there. So it's going to be a mixed bag.
It was wonderful talking to you.
Thanks, Dr. Jadev. It was nice for you asking such insightful questions and difficult questions for me to answer. But then it was a pleasure to answer the questions, and I hope the viewers also would gain something from this little talk that we had.
Thanks again. Have a pleasant evening.